Hyperglycemia refers to chronically high blood glucose levels. Most medical professionals define hyperglycemia by using the blood glucose goals that you and your physician have established and combining those goals with blood glucose target ranges set by the American Diabetes Association. Nearly 26 million Americans have diabetes, and an estimated 79 million adults have prediabetes. The new name for insulin-dependent diabetes mellitus is now type 1 diabetes. This happens when the body's immune system destroys pancreatic beta cells, which are the only cells in the body that make the hormone insulin that regulates blood glucose in the body. The new estimates show that it is important to make healthy lifestyle changes to prevent type 2, especially for diabetes.
Hi, Mr. Hicks. My name is Kathy, and I will be your visiting nurse. The doctor has sent me out to see how you're doing with your new diagnoses of diabetes, type 1 diabetes. So what I want to know from you is, have you logged your blood sugars or your glucose levels on anything that I can look at?
Mm-hmm.
Okay. It looks like that your blood glucose levels run a little bit high in the morning. Some are over 250, and I will talk to you about that in just a moment. What kind of questions do you have concerning your new diagnoses?
Well, I just have a couple of questions. The first one is, I have some friends that have diabetes, and they go out and they eat, sugar, pie, ice cream, cake, and then they say, well, they'll take their insulin to counteract the thing. Is that a good thing?
It is important to understand that you'll probably experience high blood glucose levels from time to time, despite your best efforts at control. Persistent hyperglycemia can cause a wide range of chronic complications that affect most every system in your body. When large blood vessels are affected, it can lead to stroke, heart attack, congestive heart failure, or circulatory disorders. When smaller blood vessels are affected, it can lead to kidney disease, nerve damage, and eye disease, or what is called retinopathy. If you have very high blood glucose levels, you need to seek immediate medical attention, and you need to contact your physician if you have any symptoms of hyperglycemia. Hyperglycemia can lead to any one of these symptoms or a combination of them. Contact your physician if you note any of these symptoms, and the physician will decide if this is a mild case that can be treated at home or a moderate to severe case that requires hospitalization. One thing to remember is always wear your Medic Alert bracelet. Okay, Mr. Hicks, since you've been running a little bit high on your blood glucose levels, especially in the evening time, we're going to keep a log on what you're eating, and then we're also going to, I'll discuss it with the physician on maybe changing you to a long-acting insulin. What other questions do you have about your new diagnoses?
Well, my next question is, now if I need help with getting a diet plan, since this is all related to eating, is there anybody out there that can help me with a plan?
Yes, nutritionists will help you with your diet plan, and since Mr. Hicks has an appointment on Thursday, I'll let her discuss many of the things that he will need to do to curb some of his carbohydrate intake. A healthy diet should consist of vegetables, whole grains, fruits, non-fat dairy products, beans, lean meats, poultry, and fish. People with diabetes can eat the same food the family enjoys. Everyone benefits from eating healthy, so the whole family can take part in a healthy diet plan. It takes some planning, but you can fit your favorite foods into the meal plan and still manage your blood glucose. Also, the nutritionist will discuss with you about counting your carbohydrates. You had mentioned earlier about eating maybe an apple pie, or at least a large slice of an apple pie, and increasing your insulin to cover that. It's not a good idea to guess whether your insulin, how much insulin that you would need. So the best thing to do, the nutritionist will assist you on how to count those calories and then to adjust your insulin. Sometimes when we eat high-calorie foods, we can experience symptoms of hypoglycemia also. And this refers to a dangerously low blood glucose level that drops below 70 milligrams per deciliter. It is an acute complication of diabetes and occurs in individuals who use insulin or specific kinds of oral diabetes medications. Symptoms of hypoglycemia include the following from what you see on the screen: anything from shaking to irritability. And to treat this, you must immediately check your blood glucose level to determine the amount of carbohydrate that is needed to raise your blood glucose to a safe level. One of the things to consider is using the 15-15 rule. Consume 15 grams of carbohydrates, which could be equivalent to 4 ounces of regular juice or soda, 1 tablespoon of honey, 2 tablespoons of raisins, 7 life savers, 9 sweet tarts, or 3 to 4 glucose tablets, and retest your blood glucose in 15 minutes. If it is still below 70 milligrams per deciliter, you should consume an additional 15 grams of carbohydrate. Following the 15-15 rule can help you avoid over-treatment and resulting hypoglycemia resulting hyperglycemia. Obesity is one of the precursors to diabetes, either type 1 or type 2. And as you can see here, the Midwestern states, central states, and southern states are are in the top 2 quintiles on obesity. Oklahoma ranks in the upper 10% and is at 31% obese at this present time. There was a dramatic increase in obesity in the United States from 1990 through 2010. This prevalence prior to 2011 is in a historical rate and did not meet Healthy People 2010 goals to lower obesity prevalence to 15%. Rather, in 2010, there were 12 states with an obesity prevalence of 30%. In 2000, no state had an obesity prevalence of 30% or more. Self-management education or training is a key step in improving health outcomes and quality of life. It focuses on self-care behaviors such as healthy eating, being active, and monitoring blood sugar. It is a collaborative process in which diabetes educators can help people with or at risk for diabetes gain the knowledge and problem solving and coping skills needed to successfully self-manage the disease and its related conditions.